Welcome to the second Neurodiversity lecture, hosted by LVS Oxford and LVS Hassocks. My name is Sarah Sherwood, and I am Director of Special Educational Needs for LVS Oxford and LVS Hassocks. Today, we'll be talking about masking in autism. I'd like to start with some background information regarding the prevalence of autism in the UK. Current research indicates that 1.1% of the population are autistic. However, we know that the current tools used to diagnose autism are less sensitive to females and those with an average or above average IQ, and that these individuals may not be diagnosed until they're in their 20s, 30s, or even later in life. Misdiagnosis is more common among females, with social anxiety disorder or anorexia being identified initially rather than autism. Prevalence figures are therefore not necessarily reliable, as we've seen with the ratio of males to females, which many years ago was given as 1 in 10 females to males, but we now know it probably closer to 1 female to 5 males, or even 1 to 4. Approximately 70% of individuals with autism will experience mental health challenges, which may be due to sensory experiences, social or environmental factors. Researchers refer to camouflaging in autism, defining masking as when someone monitors or adjusts their face and body to appear relaxed or interested in others, when they force themselves to make eye contact, even though this may be painful for them, when they constantly monitor their face and body in social interactions and think about the impression that they're making on others. Compensation is when somebody copies others' body language or facial expressions, learns social cues from television, film or books, watch others to understand social skills, repeat others' phrasing and tone, practice facial expressions and body language, use social skills learned from media and interactions, use script in social situations, explicitly research the rules of social interactions, and use social skills learned from watching others in these interactions. Assimilation is when somebody feels the need to put on an act. Conversation with others isn't natural. They avoid interacting with others in social situations. They're not being themselves when they're in social situations, and they force themselves to socialise, and they can't be themselves when they're in that situation. However, masking is the term that the majority of autistic individuals use to refer to their strategies for fitting in, leading to Sarah Hendricks, an autism speaker and author, saying that just because you can't see it doesn't mean it's not there. Sometimes it appears that an individual's autism symptoms reduce, but this can be an enhanced tendency to mask. Of course, the opposite is true, in that when it appears that an individual's autism symptoms increase, it could indicate a breakdown in their ability to continue masking. So why do people with autism mask? Societal expectations can result in adverse reactions to individuals who don't fit in or respond to events or interactions in the expected way. Cognitively able individuals with autism observe these adverse reactions and are concerned about the responses of others, and so adopt masking techniques, which often starts in adolescence and can become a habit. Many young people with autism experience bullying due to their adverse reactions. In Chapman et al.'s research, one individual stated that they masked because they were aware of an autistic individual who wasn't masking and was admitted to a mental health facility, and so the individual masked to avoid this happening to them. A range of strategies can be adopted by autistic individuals, including suppressing behaviours which they find soothing, such as rocking or humming. Complex social scripts are often rehearsed to give the impression of spontaneous responses. However, this isn't always successful, as recounted by a female author when she was going through the diagnostic process. The clinician asked her if she would like a break before receiving the results of the diagnostic tests, which was an unexpected question, and therefore the autistic individual hadn't rehearsed a response, which threw them, as they stated that she didn't know what the correct answer should be. Alexithymia, where an individual doesn't recognise their own emotions, may result in what may be deemed by neurotypical people as an emotional overreaction to an event or interaction. Continuous masking can become a habit for some autistic individuals to the extent that it becomes automatic rather than a conscious exercise. Masking can be so effective that sometimes even family members may not appreciate that an autistic individual is masking and may wonder why they frequently avoid certain situations or go straight to their bedroom when they get in from school. Masking can result in the autistic individual attending social situations without truly understanding its reason. Is it a friendly chat or a meeting? And if this hasn't been made specific beforehand, the individual is unaware of what interaction they are taking part in. As a general rule, society expects people to look at me when I'm talking to you. Autistic individuals may have been criticised for not doing this when they were younger, and so have found a compensatory strategy, such as looking at their communicative partner's forehead or mouth during social interactions. It's often the responses of others of social situations which result in masking. This can either be an in-the-moment response, such as, "You don't look autistic," or "You're in a relationship, you can't be autistic," or "Why are you humming?" to misconceptions such as "You can't be autistic if you have a job," without knowing that the effort involved in conforming for 8 hours a day, 5 days a week, is absolutely exhausting. Autistic individuals report that masking is exhausting as they are continually monitoring their performance against others when they are with neurotypical peers. Some autistic individuals who are employed report that they need to sleep for a couple of hours when they get home from work or be totally alone because they are so exhausted by masking during the day and need to decompress. Repeated exhaustion at this level can result in autistic burnout, where the individual struggles to function day to day. There is also the issue of identity confusion. Does the autistic individual want to identify with other autistic individuals or with neurotypical individuals? Masking is often the underlying cause for a school-aged autistic student to present in one way at school and to present very differently at home, which can result in misunderstanding of the home situation by education staff. The most effective masters are unlikely to be diagnosed until later in life, if at all. Many autistic females suppress their special interests, even though that they may be regarded by others as mainstream, such as makeup or a particular actor. It's the intensity of the interest that marks them out as different and results in the suppression of the interest. It's only when an autistic individual is in their own space that they find they can stop masking. So for some, it's 24 hours a day, 7 days a week effort. There's a link between mental well-being and masking, which can lead to impairments in both mental and physical health. The CAT-Q is a screening tool that analyses the 3 subcategories of camouflaging that were described earlier. It's a self-reporting tool and relies on the individual responding truthfully. Many of those who completed the questionnaire for Howell et al.'s research were surprised to find that they camouflaged far more than they thought. At LVS Oxford and LVS Hassocks, we understand that building relationships with autistic individuals is crucial in enabling them to talk about any misunderstandings or issues that they may be encountering in school, socially, or at home. Acceptance of autistic response is key to enabling autistic individuals to be themselves, but requires societal understanding and change. Environments that have a number of sensory elements can be overwhelming for an autistic individual, because whereas neurotypical individuals are able to filter out unwanted sensory input, autistic individuals do not have this filter. There continues to be a deficit-based model of autism, in that we speak about an autistic person's difficulties with social communication or challenges with busy environments, rather than talking about their different style of communication or their preference for quieter environments. With greater understanding of the different presentations of autism, the long-term aim is to support autistic individuals so that they no longer feel the need to mask. Thank you for listening today.